AHA BLS Certification Practice Test 2026 New 30 CPR BLS Questions. Question 1. Opioid-associated life-threatening emergency treatment. Insulin. Naloxone. Aspirin. Epinephrine. Naloxone is the reversal agent. Question 2. A child is submerged in water. Before using AED. Just use it. Dry the chest. Wait for 10 minutes. Perform 5 minutes of CPR. Wipe the chest dry to ensure proper pad contact and safety. Question 3. Ratio for adult rescue breathing, pulse present, no breathing. 1 breath every 3 seconds. 1 breath every 6 seconds. 1 breath every 10 seconds. 2 breaths every 5 seconds. 1 breath every 6 seconds for adults. Question 4. What is the first step when the AED arrives? Apply pads. Press shock. Turn it on. Clear the patient. Powering on the AED is the first priority. Question 5. What is the correct depth of chest compressions for an adult? 1 inch. At least 2 inches. 3 inches. 4 inches. AHA Guidelines, 2 to 2.4 inches, 5 to 6 centimeters. Question 6. What is the first action for a choking conscious adult? Back blows. Chest thrusts. Abdominal thrusts. Start CPR. Abdominal thrusts, Heimlich, for adults. Question 7. Advanced airway in place, compression rate is 30:2, 15:2. Continuous compressions 10:2. Continuous compressions with 1 breath every 6 seconds. Question 8. Ratio for child rescue breathing. 1 breath every 2 to 3 seconds. 1 breath every 6 seconds. 1 breath every 10 seconds. 1 breath every 5 to 6 seconds. 1 breath every 2 to 3 seconds for children/infants. Question 9. What is the universal sign for choking? Pointing to mouth. Screaming. Clutching the throat. Coughing. Hands clutching the neck. Question 10. What is the compression to ventilation ratio for one rescuer adult CPR? 15:2, 30:2. 5:1, 10:2. 30:2 for all one rescuer CPR. Question 11. Where do you check the pulse on an unresponsive infant? Carotid. Radial. Brachial. Femoral. Brachial artery is used for infants. Question 12. After the AED delivers a shock, you should check pulse. Start CPR immediately. Wait for AED prompt. Check breathing. Immediately resume compressions after shock. Question 13. How often should rescuers switch roles during CPR? Every 5 cycles. Every 10 cycles. Every 1 cycle. When tired. Every 5 cycles, 2 minutes, to prevent fatigue. Question 14. High-quality CPR includes allowing full chest recoil. Why? To let the heart refill. To prevent rib fractures. To make it easier. To save energy. Recoil allows blood to return to the heart chambers. Question 15. When performing CPR on a pregnant woman, you should push higher. Perform LUD, left uterine displacement. Only give breaths. Wait for OB. LUD helps relieve pressure on the vena cava. Question 16. When 2 rescuers are performing CPR on an infant, the ratio is 30:2, 15:2. 5:1, 10:2. 15:2 for 2 rescuer infant/child CPR. Question 17. Chest compression fraction, CCF, should be at least 40%, 50%, 60%, 80%. Goal is greater than 60%, ideally greater than 80%. Question 18. The rate of chest compressions should be 60 to 80 bpm, 80 to 100 bpm, 100 to 120 bpm, 120 to 140 bpm, 100 to 120 compressions per minute. Question 19. Depth of compressions for an infant is 2 inches, 1.5 inches, 1 inch, 0.5 inches. Approximate 1.5 inches, 4 centimeters. Question 20. If a victim is gasping but has no pulse, you should monitor them. Start CPR. Give only breaths. Wait for EMS. Agonal gasps are not normal breathing, start CPR.